My name is Dr Oswin Choga. I'm the technical advisor for Coopers at my heart.
Today I'm going to be covering a topic called the management of Theileriosis or January disease.
So, January disease is a disease that is caused by ticks, in particular the brown ear tick, and it is a highly fatal disease, resulting in up to 90% more chances of animals dying once they are affected by the disease if they are not managed. So, in 2022, Zimbabwe lost over 50,000 cattle within a year. Those were just recorded cases, which means we may have lost even more if we really try to look into that much deeply. So of that 90%, most of the communal farmers would lose up to 100% of their head, like the whole of their heads. And this was due as a result of not being able to pick up the disease and not treating early. And in the case of commercial setups, they would lose up to 20 to 30%. And this stats still stand up to this day. Because of these losses, it is very important for farmers to be able to pick up the disease early and treat it. Otherwise, there will be losses. So I'm now going to talk about how farmers can actually pick up whether the animals have got January disease or they don't have. So the signs of January disease, from the point at which the animals are infested or infected with January disease, it takes about 2 weeks or so before they start showing signs. From the point that they get a tick bite from an infected brown ear tick, it takes about 2 weeks. And from that point, the first sign that farmers would pick up is the increase in temperature. The normal temperature of a cow or a beef animal is between 37.5 and 39.5. So the first thing that it goes about that, and within 2 days, the lymph nodes become enlarged, and generally, all the superficial lymph nodes will be enlarged, while just below the ear, what we call the palpebral one, and the one that's just in front of the knee. So these lymph nodes become enlarged to the size of almost a fist. And as the disease progresses, what January disease does, the parasite or the Theileria parasite, it goes into the white blood cells, which works in terms of it helps in terms of immunity. So once they reside within the white blood cells, they start multiplying in those white blood cells, resulting in what I would call immunosuppression. And when you look at most of the cattle in Zimbabwe, they are in what we call a carrier state with red water and gall sickness. Okay, and because the immune system would have been hit, usually most of the animals, they start showing signs of red water and gall sickness, which is a topic that I'll cover on another day. Okay, but in addition to those signs, the animals will also start having drooling of saliva, and this is as a result of the destruction of blood vessels. And once the blood vessels are destroyed, it first affects the lungs. So those lungs will start swelling with fluid, and as a result, as the animals are breathing, they're actually breathing out fluid, resulting in drooling. So drooling of saliva is the first thing, and most of the cattle that die, they die as a result of lung edema or drowning of the lungs. So that's another sign that we've started seeing with January disease. And in addition to that, we've also started seeing that some of the animals, they can have diarrhea, bloody diarrhea, as a result of January disease. It's a very atypical sign of January disease. And in addition to that, you can see they get what we call a jugular pulse, where the jugular vein will be pulsating. And we all know that a vein doesn't pulsate. But in the case of January disease, that's what happens. And within, at the end of that, the animals will then die. But one important fact that farmers should be aware of is that once you've got January disease in your herd, more than half the time we've seen that the chances of it spreading to other animals is over 90%. Which means that if you see a single animal showing signs, it simply means that all of the animals may be infected, but they will be in a period where they are in between the point of infection to the point of showing signs, which is what we call incubation period or window period. So I would want to try and also talk about some of the misconceptions that farmers have about this disease, because I think it would be unfair for me not to talk about that since we've decided to get into the subject. So one of the misconceptions that farmers have is that they believe that we have a problem with Theileriosis or January disease because of tick resistance. So that's not true, because the tick that causes January disease is the brown ear tick. And yet we don't have any reported cases of resistance with that tick. So that's not true. The reason why we've been having challenges in terms of controlling January disease or this tick is because the brown ear tick as a tick is a fast feeder. So when you look at the life cycle of a brown ear tick, it spends about 3 to 5 days on an animal, feeding on having a blood meal. And when you look at ticks, we've got 3 stages. We've got what we call the larvae. So the larvae is the baby of the tick, okay? Then we've got the nymph, then we've got the adult. So one interesting thing about the brown ear tick is that it spends very little time on the animal. So for farmers to be able to deal with it in the case that they've got a January disease problem, they need to dip more often, which is where the 554 dipping comes in, or every 4-day dipping, okay? Then the second fact that farmers should be aware of is that the brown ear tick, contrary to most of the other ticks, or contrary to the blue tick, it has got a very long lifespan. Just to give you an example, the blue tick has got a life cycle of about 27-28 days. Its full life cycle is gone. But when you look at the brown ear tick, it's got a life cycle that almost up to 10 to 11 months. So what happens is that the brown ear tick, when it feeds on an animal as a larva, it feeds at a time like, for example, if it fed at a time like June, July, okay, that nymph will feed for 3 to 5, larva will feed for 3 to 5 days, but it will only mature into a nymph after 3 to 4 months. Okay, so that then presents a challenge in terms of trying to deal with the disease. So an understanding of that is critical. The ticks that we're seeing spreading January disease now, they are probably ticks from last year. So they will be in the environment, making it difficult for the farmer to control. And which is why we recommend weekly dipping throughout the year. And in the case of an outbreak, every 4 days. Okay.